All right, so I'm going to share the screen now for the presentation on inflammation. Super pumped to see you guys. I really want this to be collaborative. So if anybody has questions along the way, you guys submitted amazing questions, actually so many that we are going to do a separate podcast, I believe, talking about some of the overflow questions, which is really cool. I love getting questions that make me think. So thank you guys. And we'll get to a bunch of those at the end. But if you guys have questions along the way, just let us know and throw them in the chat. And if I miss it, I'm sure Carolyn will let me know. Awesome. So we're going to talk about reducing inflammation today. And I'm Dr. Erin Donaldson. Really nice to meet y'all. By any of you who are my patients, you know I mostly just go by Erin. So a little bit about me. I grew up in the country. I still love going on nature adventures. I live in Texas right now, so I can watch my little guys, my nephews grow up, and I'm pretty much at their sporting events most weekends. I have a couple of dogs that, if you guys are on my social media at all, you may see some funny videos of. I've known I wanted to be a doctor forever since I was a little girl, not really sure why. Went into family med because I loved it all, and then found myself in a bit of a dilemma in residency because I realized I did not, the way we handle chronic disease in our healthcare model was not aligned with my integrity. So that was confusing for a little while. And as a result, I did acute care in the hospital for quite a few years and gained quite a bit of respect for our healthcare system and how many lives it can save. But it wasn't exactly right for me. So ultimately, I started my own business for preventative healthcare and wound up eventually serving on a bit of a greater scale, not a bit, a much greater scale with Wild Health as a physician here. And this note here about my healthcare journey is one of the reasons that inflammation is so close to my heart. I was diagnosed with lupus after a string of health conditions since I was a little girl. I was diagnosed with lupus in med school, and it was a pretty tough couple of years. And in hindsight, one of the better things that has happened to me. Certainly didn't feel like it at the time. All right, so one of my mantras is that we build our health over time through daily habits, and that joy is one of the primary fuels of health. I don't think it's any one change. I think it's a culmination of 1% every single day of baby steps in the right direction. And I firmly believe that we are in the driver's seat of our outcomes. So as mentioned, I have struggled with quite a few inflammatory conditions myself. So this is a topic that hits pretty close to home. This is a picture of me in a less vibrant state than I tend to be in now. So just wanted a little vulnerability with y'all that if you guys are struggling with inflammation at all, or anybody that you love is, then I've been there and I feel you. All right, so down to the topic of the hour. Inflammation, is it good or bad for us? And what exactly is it? So both in a nutshell. So it really depends on how long it's present and what it's doing. So I'm sure you guys can intuit which one of these is inflamed, but it's certainly this hand right here, right? So acute inflammation is short-term inflammation, responding to something appropriate. So if you damage your body with chemicals, with physical damage, we've all probably experienced what happens if we twist our knee or our ankle or break a bone or get a burn or a cut or a sting. It gets red and swollen and painful and boggy like this, right? And that's our immune system responding to damage and starting the healing process. And that's a really, really good thing. But just like about everything, too much of a good thing is not always better. And if that continues to stay turned on when there's no consistent danger coming, then that is when chronic inflammation becomes damaging. Even if there is consistent signals, maybe we're putting inflammatory foods in our body every day, or, some other insult, maybe we have an infection underlying. Regardless, if our inflammation is turned on all the time, you could imagine from the look of this hand, if this is going on in our organs or in our blood vessels or in our vital tissues every single day, then that's not a good thing. That's going to lead to tissue damage and disease over time. All right, so what happens when that's on over a long period of time and we are struggling with chronic inflammation? I would imagine, I would bet money on actually, that this hits close to home for every single person on this call. I would find it very hard to believe that something on this list hasn't affected you personally or someone that you really care about. And some of these may feel smaller and some of these are very, very scary, but just about every chronic disease that we are aware of, inflammation plays some type of role in. Either it's directly causative or it's partially responsible or correlative with the disease. So it's very important to understand how to downregulate this if the goal is to live a long, healthy life where you're able to stay functional. We call that health span around wild health. And I'm sure that's everyone on this call's goal. And what are the symptoms of chronic inflammation? So the bottom is maybe how you guys have felt when you go to the doctor. Vague and difficult to diagnose. So I'd imagine quite a few people on this call have been in a situation where they look fine, but they don't feel right. Maybe they're tired or they're getting bloating after meals, or their joints are hurting in the morning, their menstrual cycles are irregular, they can't get pregnant, they're getting brain fog, lots of the things on this list. They're getting sinus infections all the time, they're gaining weight and they're not sure why. You might go to the doctor and they're like, your vital signs look fine, your physical exam is normal, and your basic blood work is fine, so you're fine. And unfortunately, when it comes to chronic inflammation, some of the lab markers can be normal and you can still feel a lot of these symptoms. So we really believe at Wild Health that catching these things early and paying attention to these symptoms is really, really key in reversing the momentum here. What causes chronic inflammation? So like most of these slides, this list is not exhaustive, but I would say for the average person on a standard American diet, the first two play an enormous role in inflammation. If you're eating like this picture on the left with any kind of regularity, I would have a hard time believing that this isn't happening inside your body on some level. It's just so highly inflammatory. The sugar, the refined oils, the alcohol, the processed refined flours, the fried foods, these things just wreak havoc on our system if we intake them with any kind of regularity. But a lot of the people we see at Wild Health are really doing a lot of the things right. They're moving their body, they're eating whole foods, they are, taking their vitamin D and their fish oil, and they're sleeping at night, and they're kind of checking all the boxes. So there are some causes of inflammation that are a bit more obscure. Overtraining is a common one we see. Chronic stress, which I'll go more into here in a little bit, is one of the more underrepresented categories of chronic inflammation that we can kind of get used to, in my experience, because people tend to excel when their bodies are stressed out and executing and making decisions. We're kind of rewarded for it. So that can be a common cause. Sometimes there's infections going on that we're unaware of, or toxins. Sometimes people have things like mold exposure or other toxins. Poor recovery or training too hard and not recovering enough. These are common things as well. And then insulin resistance and obesity really go hand in hand here. Our fat tissue is one of the most inflammatory cellular types on our body. And so if we have too much of it, then it's very, very difficult to get insulin down and to get inflammation down. And it becomes quite a vicious cycle. Here's a bit more information on a more cellular level. I know we've got a lot of medical people in the crowd that are going to understand this, but cells can get damaged or age and become senescent. Debris can accumulate. Oxidative stress can cause inflammation. Our microbiome gets dysregulated. Immune system gets persistently activated, like we talked about before. And then we have inadequate repair and detox systems. So we can't clear that inflammation once it gets out of control. All right, so my battery analogy is my favorite analogy to use with patients. You can get help with this through a wearable, like I use the Oura Ring because I find it a little less pervasive, but there's tons of wearables that give you a little bit of help in what your battery number is for the day. But when it comes to how much stress our body can take in, it depends on the person. It depends on how recovered that person is and how resilient of a state they're in. My guess is you've had seasons where you recover from stressors very well, and you've probably had seasons where you need to be a little bit more careful about your body. That's how most of us are. But I really like this analogy because think about if you start your day with a load of stress, you might already be at 80% because you have so much going on and you already have that inflammation upregulated because of the stress going on in your life. And then maybe you didn't get a great night's sleep the night before as well. So then that maybe knocks you down to 60% battery life. And then maybe you are gluten-free generally, but accidentally ate gluten or decided to splurge on pizza or whatever it may be. And then maybe that knocks you down to 40% battery capacity. When we talk about stressing our body, we only adapt if our body has the capacity to do that. So this hormesis here, or adaptive change to stress, is another way to look at it, is like a bell curve. Nature's version of what doesn't kill you makes you stronger. And if you're only at 40% when you wake up in the morning and then you stress your body with a workout that normally would be healthy, and the goal is healthy, right? If you're working out, my guess is your goal is to serve your body. But if you're only at 40% when you start your day and then you stress your body with a workout, you probably aren't going to adapt very beautifully to that. That might become maladaptive and further the inflammation in your body. So just kind of check in. And if you have a trouble checking in and knowing what percentage you are each day roughly, and how much your body can handle stress versus how much you really, really need to fill your cup back up, then, maybe consider one of those wearables to give you a little bit of a number until you get used to how that feels. All right. What is lifestyle support for lowering inflammation? So we've talked about what causes it and how it feels. How do we get rid of it or keep our body supported here? So diet is a big one. This is by no means exhaustive with the diet either, but these are just some things that I find really, really help some of my patients. This one, avoiding processed food, seed oils, alcohol, and sugar, is pretty much clear cut for every single person that those things are going to be inflammatory. For anybody with gut health issues or significant chronic inflammation that they've struggled with in the past, often gluten and dairy and grains can be similar as far as avoidance of food. And then these right here, omega-3s, fish oil, antioxidants like berries, green leafy vegetables for folate support and methylation, choline-rich foods like eggs and fish. These can be very, very helpful depending on the person. This is very important though. Every single person is different. Every gut is different. About 80% of our immune system lines our gut. And I may say that eggs are anti-inflammatory for you because it supports your methylation. You may eat eggs and you may feel your joint pain act up the next day. Your gut may react poorly. I want you to pay attention to those cues. Finding your sweet spot with exercise is really, really important to know how much stress is healthy versus too much stress, like we just talked about. Wearables can really help you determine where that sweet spot is. We don't want to be sedentary and we don't want to overtrain. My mantra is typically recover as hard or harder than you train for my patients. Sleep optimization and supporting your circadian rhythms is one of the single most important things for recovering from each day's inflammation and supporting our immune system. But this list is all really important. Managing our stress, getting outside and getting in the sunshine. Toxin awareness is one that makes me kind of twitch because I think it's a slippery slope. I think we could live in a bubble and get very concerned about all the toxins around us, and it could lead to way more stress than the benefit that we get from it. But I think simple swaps to daily touches are important. Basic filters and clean products of the things you put on and in your body. Organic produce and pesticide reduction, simple swaps that we can be aware of without over stressing about if possible. And then reversing insulin resistance might take the help of a doc, but a couple of things that help most people are strength training, and some people need fasting protocols. That can also be stressful for some people, depending on the person. And then plenty of hacks can be helpful. Most people don't want to do or need to do all of them, but finding one that's really enjoyable for you can be a really, really cool addition. So a little bit more about stress and trauma, just because I don't think it's talked about enough. I think lots of people say, oh, you're probably stressed. That's what's going on because we can't find an answer. Or just reduce your stress. Please stop being stressed and then your problems will go away. Like, these are very difficult things to execute. We can't just reduce our stress without knowing some tangible reasons why. I find with my patients that understanding the science a little bit can be very, very helpful and empowering when it comes to why stress reduction matters, and also giving them some tools and understanding how to do that and how to get into that resting relaxation nervous system that can handle, that stress better and can heal versus just the constant elevation of the stress hormones in our kind of fight or flight nervous system. So the school of thought that I'm going to be referencing from is from the field Psychoneuroimmunology, which is just a massively uncomfortable word to say. PNI is the shortcut word for it. I'm pretty sure another part of science has been added to that word, and there might be another letter being added on soon. But what it basically means is our thoughts and our mood impact our immune system, and our immune system impacts our thoughts and our mood. The science is crystal clear at this point in this. There is massive amounts of data. This is bi-directional. Both things affect both. So if you find yourself in a disease state and you're stressed about it every single day, it will increase the inflammation to continue that stress. Even if the stress didn't get you there, it is in your best interest to learn how to downregulate that. It will help you heal. And I think it's really, really important for people to understand the why. So they're not just told, oh, get rid of stress and you'll be fine. So stress actually increases the cortisol and adrenaline in our body. And then that in turn increases cytokines. You guys have probably heard the term cytokine storm in regards to COVID. This was all over the web, the news, etc. So it's quite harmful, right? And stress hormones directly increase these molecules. They also decrease the function of natural killer cells and T cells. These are crucial parts of our immune system for healing infection, amongst other things. Increased cytokines and cortisol from a dysregulated immune system, in turn, reduce the amount of serotonin. So the number one antidepressant on the market is SSRIs, right? What do? They increase serotonin. When serotonin is reduced, it impacts our mood dramatically and increases our risk of depression. So this really moves both ways. It's quite simplified, but I like to drive this home for people. There's lots of data to support this. This is just a drop in the bucket. Adverse childhood experiences like divorce, neglect, abuse, substance abuse, the list goes on and on and on. These are associated with just about every chronic disease that we know about, as well as premature all-cause mortality or dying sooner. These things this has not been studied as far as if you intervene with this trauma, what does that do to change? But it just proves the point that the things we go through in our lives deeply impact our health. High levels of stress with the perception of stress, that stress affects our health, have an increased risk of premature death by 43%, which just shows how important our mindset is. And then there's a few studies showing reduction of inflammatory markers in patients that included mindfulness-based meditation into their routine, which I think is phenomenal. And then this is one of my favorite studies that I've read about in the last few years, a 3-week intervention in a randomized controlled trial of young adults. These were teenagers, of a Mediterranean style diet. So basically they swapped their fast food for healthier food. This yielded basically normalization of depression scores on people that had pretty severe depression, and they maintained this at 3 months. How incredible is that to intervene with somebody at such a young age? All right, so this is where we get into the medical weeds a little bit, and I'm not going to do that to y'all, but I wanted to put this screen up for those of you who were interested. I think that a lot of this is common sense. I roughly estimate it's 90%. But the data can really, really help us. The data can really, really matter, especially when you're that person that's doing all the things you know how to do and you still don't feel great. I have been that person. A lot of my patients are those people, and they want help. They want this more precise to know how to target their energy here. We can look at labs and different markers to show how much is going on with inflammation in the body. I look at methylation labs. Methylation is hugely important with clearing inflammation, as well as methylation genomics to target supplements for my patients. I look at their metabolic health, their cholesterol, their insulin, their average blood sugar, and it helps me target different treatment approaches and interventions with my patients. Tons of different genes, many, many more than this come into play. But some people are much more likely to hold on to methylation than others. Some people have a much harder time detoxing than other people. Some people struggle with methylation and therefore can't clear the inflammation. There's lots of different ways to slice this up, but you really need to look at the patient specifically, which is what precision medicine is all about. It really helps target the interventions, and lifestyle is still the first focus around here. I'm building this foundation up, but some other things can really, really be helpful. Plenty of supplements, depending on what's going on with the patient, can play a role. Maybe NAC and glutathione if your detox pathways are struggling and you've been exposed to a lot of toxins. You know, if I check your omega check and your fatty acids are really low, I'm almost certainly going to add some omega-3s. If you're really struggling to sleep and recover from your inflammation that way, we may target some supplements there. If you have, you know, methylation burdens and your labs are abnormal in that regard, then we're probably going to target supplements there. Vitamin D is also crucially important for the immune system. So we check that in every single patient. And in my autoimmune patients, I have a pretty strict goal of 60 to 80. Closer to 80 is ideal for those patients, which most people are not that without a little bit of help. We also use wearables to really, really help understand where our patients are each and every day on the inflammatory spectrum. So I personally wear an Oura ring. I've done a CGM in the past, and I love my Apollo device. So these Oura rings and Whoops, amongst some other wearables, but these are commonly used by our practice. They monitor our HRV, which shows us how stressed out the body is and how easily we can toggle into that resting parasympathetic nervous system. Our resting heart rate gives us an idea of inflammation. If it's higher, then your body is going through more strain. And temperature is really, really important. If you're consistently a few ticks up on the temperature, then your body is probably in chronic inflammation. Continuous glucose monitors give us an idea of your metabolic health and how you're responding to food and energy. And then the Apollo device is just one wearable I love to frequently give a shout out to because it helps us with this HRV and getting into that resting nervous system and controlling our chronic stress, which can be sometimes vague and abstract and pretty difficult for people, including myself, to grasp without a little bit of help at times. When we're most stressed, it's most difficult to control our stress, basically. This device vibrates on meridian points, much like where acupuncture and tapping occur on your wrist or on your ankle, and really helps us get into that calmer nervous system. And I consistently see an improvement in my HRV at the times that I use my Apollo device. All right. I want to make sure. Do we have any questions in the chat, Carolyn, before I can't see it right now, before I dive into these questions?
Nope, not yet.
Awesome. So I'm going to start with y'all's questions, and then I would love to hear from any of you. Just feel free to pop in and start talking if you have any questions or write them in the chat. So these were awesome. What is a simple daily habit that consistently decreases inflammation? So I'll give you one for basically each of the main levers of health. So for nutrition, I would say avoid seed oils is one of the more helpful ones. For sleep, I would say avoid eating 3 hours before bed. For movement, I would say move your body every single day. For stress, I would say do one thing each day that brings you joy. And for toxins, I would say replace your household cleaning agents for something non-toxic. And some of these are one touch, like the toxin things tend to be one touch. You don't have to think about them every single day, you just do it once. How do you reduce inflammation after a hard workout? So this is a great one. Recover harder than you train, right? So sleep is just pivotal. Sleep is, really optimizing and prioritizing your sleep if you are an athlete is crucial. I have people with recovery genetics that are just trash on my patient panel. One guy, I think he's at 10% in our algorithm of how effectively he genetically is set up to recover. And he works out 7 days a week with phenomenal blood work and phenomenal scores because he recovers like it is his job. Because performance is a really big goal for him, but he doesn't want to sacrifice longevity. So he doesn't eat for 4 or 5 hours before he goes to sleep. And he eats a pristinely clean whole foods diet. And he regularly does cold baths after he exercises. And he makes sure his vitamin D is optimized and his omega-3 levels are perfection. So I think it's the whole picture, but the most important thing, in my opinion, is getting adequate sleep if you're going to push your body past the limit or to the limit. Another thing that we look at in our athletes is their propensity to develop significant muscle soreness or DOMS and build up or hold on to inflammation in our muscles significantly after exercise. And some people have a lower tipping point for that than others. Zinc can be a helpful supplement, and so can vitamin C for some people. So taking one or both of those after really strenuous workouts for some people can be helpful, but it's not a ticket to overtrain or excuse to overtrain. That you're never going to win that one in the long run. What are the implications of isolated inflammatory markers like C-reactive protein and ESR? Great question. In the short term, they make you feel cruddy for most people, and a lot of the symptoms we talked about with chronic disease. In the long term, elevated markers of CRP and ESR can raise your risk of quite a few chronic diseases. There's been a lot of data on increased risk of heart disease with elevated C-reactive protein. I personally think that's just one of the areas that's been most studied. I think in general, chronic elevation of C-reactive protein just can wreak havoc for chronic disease in general in the long term. So not to freak out if you get an elevated C-reactive protein and you're like, oh, I'm doomed for these chronic diseases. That's not the way it works. We reduce these. I think our average reduction in patients is about 35%. I hope I'm not misquoting that, but we reduce CRP in patients every single day with a multifaceted approach. Why are some people predisposed to inflammation and others are not? So depends. It depends what you're doing in your life. You might unknowingly have a risk for elevated inflammation in your body, or you might be one of those people that has a genetic predisposition to hold on to a bit more inflammation. So I like to tell those people they might be those people that, they might get just as much or more benefit from a little bit less training each week, which they tend to find exciting, but certainly not for everybody. But it can come down to genetics, but often it comes down to daily activities or a history of stress and trauma. Is it truly necessary to cut out all gluten? And is it true that it's not helpful to simply reduce it? This depends on the person. If you have celiac disease, it's an all or nothing game. And if you have a known inflammatory cascade, say you eat gluten and you feel bloated, or if you eat gluten, your joints are going to hurt the next day, or you're going to get a rash, or you get a little bit of brain fog, or something else happens to you when you eat gluten. If that's the case, you probably have an inflammatory cascade already built in. And the thing about gluten-related inflammation is a little bit of gluten can set off inflammation in the gut that then increases something called zonulin, which is a chemical that actually widens the gap, opens the gap between the cells in our small intestine, which causes something called increased intestinal permeability or leaky gut, which then can make us more at risk for inflammation from lots of foods that we eat that get into the system inappropriately. So if you're one of those people, a little bit can have an enormous impact. And it has a little bit of a different mechanism than something like dairy, for instance, where oftentimes if you eat less, you feel better, and little bits may not hurt you quite as much. For some people, gluten's an all or nothing game. That impact on the gut can last for a couple of weeks. But some people swear if they do less of it, they feel fine. And I'm a firm believer that all our bodies are different. So I'd really listen to your body at the end of the day. But if you have celiac disease, then it is definitely an all or nothing game. And where that matters is one autoimmune disease predisposes you to risk for more autoimmune diseases. So I tell my patients to take celiac disease pretty seriously. All right, I played football, and during my season, I'm in a constant state of inflammation. Any tips to help when resting the body isn't an option?
Yeah, girl.
So
Yeah. Yes. And
So
then
having an exciting afternoon.
if you wanted to, if I could get the babysitter, well, actually I could bring him if it's early enough, but and then meet the babysitter back after. But
Okay.
I
So if you're chronically kind of
down if you're down.
overtraining, or you feel like you might be overtraining for your body, then you can really help yourself by leveraging some of those other things. By really
In the morning is going to be more
careful about your sleep.
Later in the day.
Can everybody see?
Until sun
Can
goes
everybody
down.
kind of mute their?
Yeah.
I'm gonna try to mute. Okay, there we go. Sorry about that, guys. So when you know that you're in a situation, and I love this question because overtraining is one of these examples, but maybe you have a loved one in the hospital and your stress is high and you're not sleeping as much, but it's just something that you need to do. Or maybe you have an illness and you know that that part of the battery life is capped. It's that battery analogy that I use. If one of your areas is down and you can't do much about it or choose to not do anything about it, then you need to leverage the other sections. You need to really, maybe those are times for the supplements that help you with your inflammation. It's times to really, really prioritize sleep. It's times to really make sure the diet is clean and you're not stressing your body in other ways, to try to build that battery life back up with some of the other measures if you know something is going to be taking it down. And then also, of course, the specific exercise specific ways to reduce inflammation that we talked about can be helpful. You know, vitamin C potentially, or ice baths, and of course, just prioritizing sleep and not having like alcohol or late night food, etc. after your training days can be really, really helpful. Can diet eliminate my need for a Dmard or basically an immune modulating drug in rheumatoid arthritis? So this question is obviously close to my heart because I was able to eliminate my need for these meds with lupus with lifestyle changes. I don't think diet alone can probably do it. I think it needs to be a combination of a lot of the things that I mentioned, and that may or may not be the case for an individual patient. Some patients do all the right things and they do better on medications. I think a really, really important piece to note is that it doesn't need to be an either or conversation. Sometimes you need medications to intervene, and adding these other things on top is really not going to ever cause harm as long as it's not done in a way that contradicts the action of those medications or certain medical processes. So I typically encourage some medical help when you're trying to navigate balancing those two worlds, but it really doesn't have to be an either or conversation. But have I seen lifestyle changes eliminate the need for DMARDs or other immune modulating medications or other medications for chronic diseases every single day in my practice? And I've dealt with it personally. If you could do one thing to reduce inflammation, what would it be? On an everyday sense, I would say it's not eating late night. That's the single most harmful thing I see on most people's sleep that most people don't know about. On a meta scale, I would say it's dealing with underlying stress and trauma, because I don't think you can outrun that. And I think that inflammation will build over time until that's addressed. What is the best way to objectively measure inflammation? It seems that feeling is too vague. I love this question. So I agree. I think you can measure it with C-Reactive proteins and ESR and all the things that I said earlier. But at the end of the day, a lot of people have a normal C-reactive protein and they have symptoms of chronic inflammation. They have allergies, they have joint pains, et cetera, et cetera. So I use a symptom log in a lot of my patients so they can see how their symptoms are changing over time. I think a more accurate measurement is one of those daily wearables that checks your temperature, that checks your heart rate, and that checks your heart rate variability. And even your blood sugar can play a big role in this, but actually measuring your body and knowing what things cause the inflammation to go up and down is, I think, the most helpful way to monitor this. The readiness score or the strain score on the aura and whoop are really, really helpful to know where your body is on an inflammatory and overall stress load. I got a cortisone shot in my foot, and to my surprise, it helped with joint inflammation and all over my body. Are cortisone shots safe? So to the second part, depends on the person. If you are experiencing effects all over your body in the positive, then you're probably experiencing effects of the risks as well. Things like elevated blood sugar or, weakening of tissues. Every once in a while, a cortisone shot for most people without diabetes is not a huge deal. Long-term steroids are a really big deal. They downregulate our immune system, which is there for a reason. So frequent use of steroids is a sign that you really need to address inflammation in other ways. And if you take steroids for a specific injury and realize your whole body feels better when you're on them, then it's a sign that you had a lot more inflammation than you maybe knew. And I would invite you to explore some of the lifestyle changes that we talked about today. And then multiple questions on what the role is in lifestyle and reducing inflammation after some very significant events in people's lives. People that had heart attacks, cardiac events, strokes, kidney disease, post-COVID disorders, all kinds of stuff. And I love these questions because these are very real life examples. These aren't people trying to just have pristine health, but these are people really, really wondering, do they need to stay on these medications for the rest of their lives? Or are there things they can do with their life that can help? And I was in a very similar situation when I got my lupus diagnosis, and I asked my rheumatologist, is there anything I can do with my life on a day-to-day to help my body here? And I was told no and laughed at. And without any hesitation, I can say there is an enormous role for lifestyle in every single one of these cases. It may not mean that you can go off your medications. That's a specific conversation with you and your doctor. And if you can't, or your doctor doesn't want to have that conversation with you, or you don't feel comfortable, I'd invite you to explore options where doctors do. We help people balance these two things in wild health every single day. I have patients come off of chronic medications every single day, and they do that by shifting lifestyle changes that we talked about today. They do that by reversing their insulin resistance and by decreasing their inflammation and by lowering their blood pressure through weight loss and healthy eating and targeted supplements and all these other things. So it really depends on the specific case, but there's ways to get data here, and it's not an either or conversation. You can be on all the medications you need to be on, and these things will still help. Moving your body every day and not eating processed food. I mean, I don't think that's going to hurt any single person on the planet to avoid fast food. So that is it for the presentation. I'm not sure exactly. There are references if you guys want to look up any of these cool studies. But who else? I'm going to stop sharing and just kind of open the floor for questions.
There's also a few in the chat as well.
Perfect. Oh, fun. Okay. Jane says, is there any specific type of inflammation that you consider to be healthy? Yeah, acute inflammation. So inflammation that happens in response to an injury helps us heal. So a short amount of inflammation is really powerful. Our body's intelligent. It's doing this for a reason. So the question I ask, if it's turned on all the time, is why? Why is our body either have a confused inflammatory system, and how do we fix that? Or is there something ongoing as a signal that we need to remove that our body's trying to respond to? So yes, I do think inflammation can be healthy in short bursts for the appropriate thing. Omar says, what does the Apollo device provide beyond the aura or Whoop? I wear an aura and get HRV and RHR from that. So Apollo is, oh, I wish I had it here to show you, Omar, but it's plugged in the other room. Apollo is an action-oriented device. It doesn't measure. So it actually vibrates on, I wear it on my wrist. Some people wear it on their ankle. And I probably only use it once or twice a week after a particularly stressful day, or if I have really late screen time for any reason, and my sympathetic, if I'm just like targeted into decision mode or stress mode, and I really, really want a little bit of help down regulating, I'll slap it on and put it on relaxation or sleep mode. And it has different vibrations that vibrate on the wrist or the ankle, wherever you want to wear it, and really, really just assist and kind of take some of the work out. A lot of our de-stressing actions that we have patients take are more of a stop. And I think that can be really hard when we're in go mode, telling people to clear their mind and meditate or slow down. But I think something specific and action-oriented, more of a go, can be a little lower hanging fruit, which sometimes we just all need when we have a lot going on. And so it's very,
it's like more of a biofeedback device.
kind of, yeah, kind of. Yeah, but it's not going to measure your heart rate variability. I just, for fun, measure mine later to see what's happening as a result and see if it's working.
Okay.
Great question. All right, Mike says, how long do you recommend ice baths after a workout or other cold exposure? Depends on the person and that hormetic curve that we talked about. What does your bell curve look like? If your boundary is frequently at 10%, then you probably have a really tight window. You probably need to go low and slow with, small bursts of hormetic stress, small bursts of exercise, followed by small bursts of cold therapy. If you're at 100% and you're recovering like a boss, you can do a tough workout and probably do ice baths every single day and thrive. So my autoimmune patients, for instance, I had them start low and slow. I had them avoid ice baths and start with cold showers for a couple of minutes, Monday, Wednesday, Friday in the mornings, maybe. But for the average person that doesn't have significant inflammation, that's trying to really get the benefits post-workout, I would say 5 minutes or so in an ice bath is probably a good place to start. Robert says, can infrared sauna help with DOMS? I would say the answer is yes, with the asterisk that you are appropriately repleting your minerals and electrolytes. If some of your DOMS is coming from zinc deficiency or potassium depletion or sodium depletion, or some of these other things that can happen that really affect the way our muscles fire, then it can be putting fuel on a fire. In general, doing a little bit of sauna post-workout can be really anti-inflammatory, as well as can further activate the benefits we get from exercise. But again, this all comes back to that bell curve, that hormetic curve. So you need to be pretty recovered and pretty repleted in your minerals and your electrolytes for that to be super helpful right after a workout. A lot of our patients at Wild Health are very well tuned in, and they do this really beautifully on a regular basis. A lot of our patients work out in the sauna. It's not where I really recommend people start. But the name of the game with sauna is it's really helpful if you are not overtaxing that system. So some people pay attention to their heart rate during their sauna exposure. And if you're tacking away at 110, 115, sweating, feeling fine, and then all of a sudden you go up to like 140 and you feel not great. Those are our body's cues that you've probably hit that allostatic load point, that stress point. You're playing with fire there, quite literally. You're running the risk of this being a bit damaging. So replete your electrolytes and, talk with your doc about it, especially if you're one of our patients. A lot of you on here are, and a lot of our tuned in or really well-tuned patients can do very well with sauna after exercise. James says, what's your take on acceptable levels typically used in traditional care? I might be just misreading this or misunderstanding, James. I'm not sure levels of what. I could go off on a tangent about my thoughts on traditional care, but I don't know that this is the right format for that. James, if you think of this, let me make sure it's not on the bottom. Oh, blood levels.
Yeah, he just commented it.
Got it. Thank you so much. I'm guessing you're talking about blood levels for inflammatory markers, and correct me if you want to talk about something else. So C-reactive protein, a high sensitivity C-reactive protein, is the most commonly used marker right now that we're using at Wild Health. A quote normal, he says testing for potassium. We'll talk about CRP while I'm talking about it, and then I'll go to potassium. Normal value in typical lab markers is 3 for the cutoff. We use 1 at Wild Health. So any level above 1 for any significant amount of time that's not transient after a workout is something of that nature needs to be addressed. Traditional acceptable levels of potassium in traditional care. So depends as far as like repleting electrolytes, I'm guessing is what you're getting at. And, some of the electrolyte supplements out there are a bit higher, like Element has 1 gram of sodium, for instance, which might freak out some traditional models of care. Potassium in the blood levels that we look at, 3.5 to 5 is really acceptable, or even up to maybe 5.5. But after we deplete transiently, those blood levels don't really talk about total body stores of these electrolytes and minerals. So when we deplete these things from sweating, you know, we don't just sweat water, right? We sweat all our minerals out as well. So replacing those things, if we've had a lot of sweat from an exercise or a sauna or something like that, can be really, really important. So it depends on the person, but for a lot of our athletes, I will recommend Element for the levels of potassium, magnesium, and sodium in them. So hopefully that helps. Glenn says, what are your thoughts on anti-inflammatory supplements? Turmeric, celery seed, tart cherry. These seem to help with my gout, and I often wonder of the long-term consequences or other contraindications. So my take on anti-inflammatory supplements is they're great in certain situations for short term. So if you are trying to address inflammation that maybe you injured your shoulder and you have acute inflammation that then is hanging on a little bit longer than you want, those are times where we want to try to downregulate it. And I tend to favor things like turmeric over like taking NSAIDs for a significant amount of time, which can cause leaky gut, which can further inflammation in the long run. If you need an anti-inflammatory supplements on an everyday basis for things like this, I think whole foods are a better place to get them. And I also would ask the question of why do you have the chronic inflammation that is requiring the anti-inflammatory supplement? And I would invite you to discuss that further with your doc. As a general rule, they're not harmful. That being said, we do need some of that acute inflammation, right? So I personally don't have almost any of my patients on daily antioxidants and daily anti-inflammatory supplements, because I think we need to be able to turn those cascades off or on in response to oxidative stress and inflammation. And I think if we're consistently down regulating that, there's a bigger problem at hand. All right. Varkey says, is chronic acidity related to inflammation? It certainly can be. So if you're having something like GERD, for instance, or acid reflux, which might be what you're talking about, it can be related to gut health and dysbiosis of the gut, dysregulated microbiome. You know, that's a whole slippery slope of increased acid in the gut. Most cases of GERD don't actually have increased acid in the gut. Any amount of acid that comes up to the esophagus is going to be extremely uncomfortable. So it oftentimes is more of a motility issue in the gut, that you're not actually digesting food appropriately. Oftentimes people don't have enough acid. If you're talking about acid from another reason, then please clarify that for me, Varkey. But I would really say what is probably the most helpful thing here is that once we get our gut health more intact, then our inflammation becomes more regulated because of that massive amount of inflammatory cells in our immune system that lines our gut. It's just such a key role. So getting our acidity and our pH of our gut where it needs to be is one of the things that can really help. Acid blockers, for instance, would point to this not being true, right? With the chronic acidity relating to inflammation, because we block acid with a PPI, and the data shows that you have an increased risk for autoimmune disease if that's the case. So there could be an argument made that if we block that acid, you actually have an increased risk of inflammation from that gut dysbiosis and leaky gut. Robert says, will I be able to see this recording at a later date? Yes, it will be put on YouTube. So hopefully by tomorrow, I think, but don't quote me on that. Robin says, what do you consider a good readiness score with an Oura ring? Do you need to always keep in the 85 range if you're trying to decrease inflammation? It's different for everybody, which I think is probably annoying as many times as I've said this today. What I typically do with strain and readiness scores with my patients is find what their average is. If you're sitting between 60 and 80, my goal is not for you to not move and exercise. You're never going to get where you need to go. But what I typically say, maybe in that case, maybe when you're below 70, you don't do any kind of high intensity training. Maybe when you're below 70, you do your active recovery, you do sauna, you do yoga, you do low intensity strength work. And when you're above 80, then you go do your zone 4 and 5 training and you really hit it when your body can handle it. And then we baby step those goals up. When people do that and they really pay attention to how much their body can handle and where their bell curve is and that battery life, right? When people really know where they're at with that, then typically 3 months later, we're talking about averages of, 75 to 90 on their readiness scores versus the 60 to 80. So it tends to go up slowly over time when we handle it that way. So I usually give people a cutoff for intense training when they're in their lower zone, probably their lower third. I usually have them cut it off, but there can be multiple variables. So again, I'd really ask one of your health coaches or docs to help you with what that number is for you. That's it. Does anybody want to chime in? So I'm not just the only one talking the whole time. I appreciate all these really wonderful questions. And there's more that I didn't get to. I appreciate you asking them and writing them. They're awesome questions, and it gave us an idea for another podcast. So if you didn't hear your question answered today, then I'm really looking forward to answering them on the podcast. And I don't know if I want to invite more, but I guess we should. So if you think of any other ones, just let us know. All right, guys, I'm going to stop the recording now.